Hello viewers. So let us discuss about semen analysis in this video. See, generally semen analysis means this is done in various places. Most of the diagnostic centers, they do regular semen analysis, and sometimes it's difficult for the patients to understand the semen analysis report. In fact, some doctors also find it difficulty in understanding a semen analysis report which is done in a fertility center, because there are so many parameters and they don't know how to interpret semen analysis report. There are so many percentage values, sometimes velocities. So now let us discuss about semen analysis report. Generally in semen analysis report there are few things which are important. Few are macroscopic finding, few are microscopic findings. Macroscopic findings in the sense what we see, what is the color of the semen, what is the volume of the semen, and whether the semen is getting liquefied properly or not. That means basically viscosity and liquefaction. These are called macroscopic findings. So now why these macroscopic findings are important is, see now if your semen volume is on the lower side, that means see normal semen volume is 1.5 to 2 ml minimum value for a semen analysis. If it is less than 1.5 ml, then even though other parameters are normal, the chance of natural pregnancy is on the lower side. Even if sperm count is normal and all other parameters are normal, if volume is less, then again getting pregnancy, it can affect the pregnancy chances. So now what if semen volume is less? Then it can be because of low testosterone or sometimes infection in the semen. These things can affect pregnancy chances. So second thing, color of the semen, again this is important. Whenever there is an infection, it can look light greenish color or yellowish color. If blood is mixed in the semen, it can look brown or red in color. So that is how we can assess what is happening in the semen analysis. Liquefaction or viscosity are signs of infection, prostate infection. So now these are the macroscopic findings, and then we go to microscopic findings. In microscopic findings, we look for three parameters. One is concentration, that is number of sperms per ml, number of millions of sperms per ml, and second one is motility, and morphology is shape of the sperm. How many sperms are normal, how many sperms are abnormal. So when it comes to concentration, so generally we don't give importance to total number of sperms in the ejaculate. We always give importance to concentration of the sperms. That means how many sperms are there in 1 ml of semen. So now on average, the lower according to WHO guideline, the lower reference value is 16 millions. So if it is less than 16 millions per ml, then the chance of natural pregnancy is on the lower side. But doctor, 16 millions, if I have 16 millions, it is enough to get natural pregnancy? But we can't say. See, average, generally this is 5th percentile value. We have 5th percentile value, 50th percentile value, and 95th percentile value. So generally we don't want higher levels, 95th percentile value. 5th percentile value is the lowest reference value, that is 16 millions, and 50th percentile value is around 50 millions. So now if you are on average, if you are having 30 to 50 millions, that is a good number. That is a good number to get pregnancy. Then coming to motility. Motility, we have two types of motility. One is total progressive motility, and second one is rapid progressive motility. So progressive means there are some sperms which are just shaking or just moving at one place. Those sperms are not, they are non-progressive sperms. What we want is sperms which are actively moving forward in semen analysis sample. So the percentage of total progressive sperms should be at least 30%. So 30% is the lower limit. That means out of every 100 sperms, at least 30% of sperms should be moving forward. And the rapid progressive should be at least 10% of the progressive motility. So now coming to morphology, morphology is very important, because if all other parameters are normal but morphology is abnormal, still it can lead to infertility. And according to us, that is the most common factor which is affecting fertility in males, and which is common. This is also commonly misguided problem in regular semen analysis tests which are done in small diagnostic centers. Most of the small diagnostic centers, they don't mention about morphology, or even if they mention as around 80% normal, 90%, which is a blunder. So according to WHO, they say 4 to 9% is average for semen analysis, 4 to 9% of sperms. You may be thinking that, doctor, out of 100 sperms, only 4% sperms are normal, is it enough? Yes, that is what WHO says. 5th percentile value is 4%, and around 50th percentile is around 9 to 15%. So even if you have around 7 to 9% of morphology, this is enough. Even if 90% of sperms are totally abnormal, still it's okay, because this is according to strict criteria. Basically, we look under very high 100x microscope. So now, even though there is a small variation in the morphology, we count it as abnormal, but those sperms can fertilize. So now, according to strict criteria, if it is around 7 to 9%, it is more than enough, but 4% is the lower reference values. So these are the semen parameters what we have to look for. If at least one or most of the parameters are less than reference values, then immediately you have to consult a doctor and get it treated. Thank you.